health coach program is a way for patients to get into contact with resources they really need, such as high blood pressure classes or diabetes classes.
Like being a health coach is almost, in a sense, like a social worker because we collaborate with the county.
We undergo a lot of trainings, such as cultural sensitivity, and we practice a lot of patient contact and conversations that would be had with a patient, and we also learn about what is hypertension and what goes on in the body while your body is managing diabetes, and some of the most important ways that you can manage those.
I've also learned that a lot of the diseases such as hypertension, diabetes is solely because of the areas that people live in and the socioeconomic background that they're placed in. So you want to find poor black people out there in the ghetto, and they live in the ghetto. There's not really many grocery stores for them to eat from. Employment's not that high, so those two things alone can lead up with stress and then bad eating habits to live with diabetes. So I'm more literate when it comes to understanding how diabetes and hypertension affects the body, what causes it, and then seeing that in outside the community.
Learning the role that I play in my community as a product of immigration and from a Latino background. A majority of the individuals that I interact with currently as a health coach have just informed me of my position of privilege and my ability to use resources that are available to me and how that doesn't always happen for other people.
I've seen a lot of the social disparities that come within living around the Bay Area, whether it's food deserts and learning about how our environment really impacts the youth and it goes into the people's adulthood.
I think the only reason why I'm able to do my job effectively is because I come from that community. A lot of my patients I work with are black. Some of them are brown, but I can relate to the struggles that they come from.
Just me being able to speak Spanish has really changed the outcome for certain patients.
Our main services are getting in contact with patients and seeing how they feel they're managing their high blood pressure or their diabetes. Once we establish a relationship with our patients, we begin asking them about their home life and other situations that they might have to deal with that are difficult for them, whether it's immigration status, affordable food, housing.
They can connect to primary care as filling out a health pack application or a Medi-Cal application.
Resources that they need to survive every day.
Having a better understanding of what they're actually trying to connect to.
And having health coaches as a liaison between patients and those services is very beneficial to them, helping them navigate the healthcare system and other resources that are available to them. And we get them into contact with people who may be able to help them.
Working in Highland Hospital, and a lot of times when I talk to the patients, they can't relate to the physicians that are helping them, and I think that cultural awareness and just, that appreciation that they have, knowing that you have someone that looks like you, trying to help you, and that care about you, that makes a huge difference.
I think ultimately what's lacking in our healthcare field is not the ability for people to become providers, but for them to be competent and for them to be convicted. And I think that the health coach program does a good job of both of those things. Just this sense of accomplishment that when you do connect a patient to a resource, or when you help them understand that the medications that they were taking, it's not that they're not working, maybe they're not taking them correctly. When you just kind of clear that fog and that haze from the patient, and you see those light bulbs go off, that we aren't just trying to put more black and brown individuals and men and women of color out there just for kicks, but when we can make it matter, that's when we get really effective providers.
Helping the community become healthier as a whole.
We need more people that look like us, helping each other.